morning, good afternoon, and good evening. I'm honored today to introduce the next speaker in our esteemed series for the Hamlyn Symposium. And today we have the pleasure of hearing from Peer Fischer. Peer Fischer directs the Micro, Nano, and Molecular Systems Lab at the Max Planck Institute for Intelligent Systems, and he's also Professor of Physical Chemistry in the Institute of Physical Chemistry at the University of Stuttgart. Peer is an alumnus of ours, having received his BSc in physics from Imperial College before moving to our competition at the University of Cambridge, where he completed his PhD degree. He then became a NATO postdoctoral fellow at Cornell University and a Roland Fellow at Harvard, where he headed an interdisciplinary research lab for 5 years. Peer won a most sought-after Fraunhofer Attract Award, 2 prestigious European Union ERC grants, and a World Technology Award. He's a member of the Max Planck EPFL Center for Molecular Neuroscience and Technology and the Research Network on Learning Systems with ETH Zurich. Professor Fischer is on the editorial board of Science Robotics, and he's a fellow of the Royal Society of Chemistry. He has a broad research interest, including 3D nanofabrication and assembly, micro and nanorobotics, active matter, molecular systems engineering, and biomedical applications. Today, he will be talking to us about nanorobotic systems that penetrate tissues and organ phantoms for surgery, which promises to be awe-inspiring. Peer, thank you for being with us, and please feel free to share your screen with us whenever you're ready. Thank you, Peer.
Ferdinando and the Hamlyn team, many thanks for the invitation and opportunity to present here today. I'd like to give 2 topics because there might be a broad audience, and so both of these are the works of a team that I'd like to thank. This is my group here at the University in Stuttgart, as well as at the Max Planck Institute. And in particular today, I'll be talking about work by PhD student Engin Choi, Vincent Kadiri, Florian Peter, as well as Tian Qiu, who now heads his own group. We also acknowledge funding to make this research possible. So for the Hamlyn Symposium talk, as was introduced by Ferdinando, many thanks for that introduction. I'd like to switch the order, and I'd like to start from the macro scale, asking the question whether we can mimic the environment in which a surgery takes place. And then thereafter, I will try to look at systems we can develop or that we work on for targeted delivery. So let me start with organ phantoms for surgery. And it really is motivated out of work that we like to develop some microsystems and we'd like to test them, of course. And like many people, one needs to resort to a model, to tissues, to organs. And in this particular case, we were working on a wireless miniature endoscope that doesn't need a single wire, but you can still use it to look around in space using ultrasound. And we had to test it, and then we ended up having to get these bladders as a model for the bladder inspection. And this was rather cumbersome, difficult to get a hold of. The organs don't last very long. They're difficult to handle. They're often anatomically not correct. And so this led us to the question on whether there are any models. And then, of course, as I've known from going to Hamlyn Symposia, you see robotic instruments and you see displays. And very often things are used which are very far from an organ. The robotic surgery may pick up some pegs and move them around in space, or here suturing on a grape. But it turns out this is not just in a conference as a display. This is actually also what happens to some extent in the training. There aren't really very good surgery models. And this has led us to the path of trying to figure out what is out there. And really, if we think about it, in surgery, it's quite amazing. I mean, if you step in a plane, you can be pretty sure that the person who's in charge has had many hours of training and has had control and has had a quantification on whether they're actually able to do what they're supposed to do. Probably months of training and with a very good measure of what's going on. But for surgery, that's tricky. There isn't really a simulator that you can step into and that gives you good feedback or which you could use to test procedures. And so there really is hardly any training like that. And one immediately steps right into the operating theater and doing basically the surgery. So How do you quantify something? I think this brings up questions that we can perform a surgery, but it's very hard to quantify it because every patient is different. And you can't take the patient after a procedure and stick them under very high resolution X-ray imaging, because that would be unethical to figure out whether everything went the way it was supposed to. Also, there might be some complications because of a totally different thing. The patient might have had diabetes or something else, which got nothing to do with the surgery. So how can we find quantifiable measures for surgery? And that brings us to these phantoms, to test equipment, to plan surgeries. And one has either the choice of using animals, but very often the anatomy is just wrong. It is plain wrong and often not very useful for certain surgeries, and it's ethically problematic, and it's expensive, and it doesn't last very long. You can buy some models, but very often they are totally unrealistic, very simplified, lacking anatomical details, and having not the correct material properties. And then, of course, a big area of development are virtual systems, which are great, but you cannot test your medical instrument because you can't actually cut anything. You don't get the haptic feedback. So there seems to be a space for doing something with real materials, and one might think that 3D printing is a good way to go. And models have been made with 3D printing, but it's difficult because the materials that you can print don't have typically the properties that tissues have. And so there is a limited scope of materials, difficult to kind of have systems with cavities, and hence we need something else. And so basically, out of a lack to test our own devices that we were developing, we started this, and we started with a human cadaver organs. So this is a real organ that we can then scan with very, very high resolution, because of course it's no longer alive, and we can use contrast agents to get very good models, 3D models of organs. And these we can stitch together and get a computer model of the organ. And then we can resort to 3D printing, but not to print the tissue, but to print the outside and the inside, basically the molds. And this then allows us to use these fabrication techniques to get the structure right. But then we have a lot of choice and freedom, because we can now mold this, i.e. we can make the tissue out of convenient materials that we choose in such a way to get the right haptics, to get the right imaging contrast, and even to include, for instance, disease models like cancerous tissue and other things, which would be difficult otherwise. And so in this particular case, there is a transparent model, which might be very good for educational purposes. And this allows us to really get organs with very high degree of accuracy. So there are CT scans of the real organ and the phantom after we made it. And the error is below a millimeter. So we're talking of 500 micron errors, and we can get a lot of anatomical detail that is missed, as far as we know, pretty much in every model you can buy. And furthermore, because we can choose materials for the fabrication, we can get the right imaging contrast. So if you choose materials like PDMS or silicone elastomer, you can see that the ultrasound image is completely useless. It doesn't really reflect the organ. But for instance, if we make our organs out of hydrogel materials, we get very nice looking images that are, to a surgeon, as good as the real organ. And so this opens the opportunity to take it one further and ask the question, can we take it to surgery? And the first system that we looked at, we started collaborating with urologists. So we started to build our organ system around urology. The first surgery we looked at is the transurethral resection of the prostate. So as the prostate grows, and this will be something that will be an issue pretty much for every male, there is also benign prostatic hyperplasia. It grows, and it, if you like, squeezes on the urethra. And so at some point it becomes inconvenient, and one needs to open this up. So you go in with a tool and you shave out material to widen the canal, if you like. Now, to come back to the material, if we were to use something like PDMS, which is very popular, we are in a very high Young's modulus. It's unrealistic because the actual tissue is much lower. And furthermore, there are slight differences between normal tissue, the hyperplasia tissue, and cancerous tissue. And by choosing this molding method, we can make combinations of materials that will mimic this Young's modulus in the correct way. And we can also include things like sugars and fats and other things which will have, for instance, the right conducting properties, because in this particular case, the surgery is with a hot wire that's obtained by AC current. And as you can see here, this is from a YouTube video. This shaves out prostate tissue by this hot wire. And this is what the surgery looks like. The surgeon sees it through an endoscope and it starts shaving away. And what we want to mimic is the scarring as well as the behavior and the bubble formation. And if you were to think of an elastomer, it would just stink and it wouldn't cut. This here is like a tissue. It has similar scarring. You can see the slight carbon forming. You can see the bubble forming, and it looks and feels like the real surgery. And this then allows us to also do something which you can't do in a real surgery, because we can now inspect what happened during the surgery. So we can take data like CT or MRT data, and we can check that it operated in the right way. This is just to confirm that you can really do also a lot of material testing. You can do analyses of the actual yield stresses. You can do rheological properties. You can do conducting properties, absorptions, etc., which surprisingly for many tissues are not very well cataloged or even measured. So once one has that information, one can let it go into these materials formulations to mimic the real tissue for the particular surgery. And so now comes actually something which we think is quite powerful, because we can, when we make the phantom, we can include additional imaging contrast that is not visible to the surgeon. So in this particular case, this is for the resection of the prostate. The surgeon looks through the endoscope, so it sits inside this canal and looks optically. But it doesn't stop us, for instance, if this is the prostate, to use an ultrasound contrast agent, which is not used during the actual procedure, for instance, to mark very, very nicely what the capsule, the peripheral zone is, which is an area that should be preserved in surgery, because otherwise there can be complications. So basically the surgeon doesn't see it, but we can mark the capsule because we can give it a different elasticity, a different behavior like the real thing, and we can mark it with an imaging contrast. So later on, we can come and check precisely whether it worked properly or not. And here you can see this capsule illuminated for our analysis. And here is the result of such a procedure. So this is now using ultrasound. This is our control imaging. It wasn't used during the actual surgery. We can stitch together the entire urethra and see before and after. And here we can see what an expert has done during the surgery. So we can actually find out, how was the cut? Is the cut smooth? Is it centered? Is it big enough? Is it far away from the capsule? Was there any danger to this capsule? How long did it take? And you find surprising results that even with the medics that we worked with, they didn't know. For instance, they of course hold the tool, and the tool is heavy, so it pulls down. So the expert, for instance, didn't know that the cut is off-center downwards. Because of that. So it's something that is information that is available by models, which could be really interesting for surgical training and testing tools. And then here are some examples of other people who did the surgery. So here's a fellow that did it. So some experience, but not quite as experienced as the expert. And one can see that the cut is maybe not so smooth, and still it's fine, but it isn't quite as smooth as the other cut, and maybe the volume that was cut isn't big enough. And so this, I think, opens up a real opportunity for training and also for learning about surgeries and quantifying them that aren't possible. So we are quite excited by this. And of course, here is an example of an amateur where it went wrong. So this is somebody who had very little experience. The cut is terrible. And even at one point, it compromises the capsule, which would have been, of course, a bad outcome in the surgery. So this is somehow a direction which I think, I'm surprised it isn't developed further. I mean, robotic surgeries, other surgeries need to optimize, need to test. Here you can make sure that your model is always the same. You can have full quantification. You can compare it with other models, and therefore you can now get an idea what tools do what and how well do they operate. And I think this is an interesting area, and we have now expanded from, this is an example of the prostate and the kidney, we have now the liver, we have the bladder, and we're slowly filling the torso with these organs. And there seems to be a lot of interest to have them for testing equipment and for using them in a way that isn't possible with animal models. So here is an example. We're trying to expand this and get this realistic feeling that the haptics is right, the visuals are right, and the imaging contrast is right, and it behaves correctly with these medical tools. And there's still a lot one can do. And so hopefully it will allow for standard evaluation, some nice performance criteria, some feedback, and maybe even it will go to a comparison with pilots that one can, at least in the initial stages, get good hands-on experience, progresses far enough, and then enters the operating theater. So we're developing this further. And of course, we're very interested to hear of anyone who has ideas or wants to work in this area and to develop these phantoms. So now I'd like to switch gears entirely. So now I will going into real tissue. It's again about tissues, and it's about targeted delivery. And our focus has always been to try and enter tissues. And the human body, of course, is complex, and there are many barriers that we are aware of in the human body. They have a good purpose. They protect us from pathogens most of the times, but it means that anything that you apply has the difficulty to having to cross these barriers. For instance, skin, I think, is a wonderful example. You can probably, most of products that are used in the skin are very ineffective because they can't enter deep into the dermis to actually deliver anything. And one inspiration is that one attempts a way of targeted delivery. So can we cross these barriers, the blood-brain barrier? Can we go through mucus, which protects our organs, which is everywhere in the lungs, in the intestine, etc.? Can we deliver something more targeted? That would mean we're more effective. We can maybe use more potent medications. We avoid systemic effects. And there has been an interest, and for instance, magnetic particles have been used, magnetic nanoparticles that can be pulled with a magnet. But this is slightly ineffective because these gradients that you need to pull these particles are very short range. And so this doesn't scale very well. And to get forces across the length scale of a body is rather difficult. And so one can also look to nature for inspiration, because pathogens have developed some really remarkable ways on how they can enter and cross these biological barriers. So here is a really a creature, schistosoma, that causes diseases in the tropics. This is what it looks like when it swims in water. Really bizarre, but it operates at low Reynolds number, and it can swim. But then the amazing thing is, from a biological standpoint, of course, the terrible thing from the person who gets infected is that it can then reach, for instance, a person standing in a river, and then once it reaches it, it's in the skin, and at its length scale, with several hundred microns, it drills in there in a remarkably short time. It's unbelievable. There's no medical tool at this length scale that can do this so seamlessly, yet somehow nature is able to. So if we can copy these mechanisms, these could be very powerful tools in medicine. The ones that we've become interested in for some years now is the locomotion of bacteria. They use basically these flagella. The flagella are like corkscrews. They drill themselves through fluid at these length scales. And this has inspired us to look at these very, very small drills, because the advantage is, going back to the nanoparticle delivery, via pulling is that we can now use what is known as homogeneous magnetic fields. So if you hold two magnets, then the field between is a homogeneous field. And if you now rotate these two magnets, the two opposing poles, the blue and the red, and you rotate them, then you could take the drill and rotate it, and there you have a wireless drill. And that scales much better over distances. And this alone is not sufficient, because for real applications, people have built setups that fill a whole room, and then you can operate and move a millimeter drill, but it becomes a little bit impractical because you need so much hardware. If you don't fill a whole room and you want a practical solution, that typically means your fields are weaker. So you need to have extra tricks to go through tissues, because tissues, even though they're made out of water, are difficult to penetrate. It's really surprising. And it's not just difficult for our artificial systems, it's actually also difficult for natural systems like pathogens to go through real tissues, as I'll illustrate. And we can take inspiration nevertheless. How small do you have to be to make it more easily through tissues? So tissues, what are tissues? Tissues are macromolecular networks with water, and these networks have, if you like, a mesh structure. Whether this is the mucus, whether this is the vitreous in the eye, wherever you look, you get these, and you can measure these. For instance, you can try and pull particles of different sizes through, and then discover how small the particle has to be to go through with very little resistance. And for instance, here we've measured this. This was in this particular case bovine vitreous. We have looked at many other systems, and it always turns out that you have to be on the sub-micron scale. So there's a real purpose here for going in the direction of nano systems and nanorobotic systems. And here you see the motion velocity of these particles as a function of their size, and they don't really want to move because they get stuck. And then below these sort of 500 nanometers, they start to slip through. And hence, if you make things small enough, you will be able to penetrate tissue more easily, i.e. you can use weaker fields, which are much more easily to be implemented in a real medical setting. How do we do it? We use a fabrication technique to make these tiny drills. We don't heat something and make a thin film, but it's related to this technique. We also have material that we like to use. We can also heat it in a vacuum chamber, but we use our substrate in this bizarre angle here with some nanoparticles, which means we can then get discrete growth because they're shadowing. Material will land here. What misses the first one lands on the second one, etc., etc. So in parallel, we can go many structures. We can manipulate this, and then we can form interesting shapes. And so in this particular case, this is an animation. We will heat the material, we will have the angle substrate, and we can start angling and rotating it, changing materials and getting shapes. One shape that is interesting and very effective is this drill shape, which is the same length scale as a bacterium. It's now made out of artificial materials, if you like. It can be silica, it can be oxides, metals, whatever we like. And we can include magnetic, a small bit of magnetic material, so we can exert a torque on it. Then it's a bit like a corkscrew. And these we can control very, very well in solution. This is in water. This is a fluorescently labeled one, real time. We can move them around with 3D with very high accuracy, right? And here are some examples of them. We've worked for this for a while. And so the obvious question is, can we use it and transfer it to tissue? And we would take a wafer, we can sonicate the wafer. We have about 100 billion of them in one growth, which we can get in a few hours. And then we can transfer them to solution, and we can hopefully use them to penetrate these complicated networks. And the other thing which is nice in these artificial systems is that we're not restricted to the systems that nature builds. Nature has a certain size for bacteria, because when they are too small, it makes no sense. Then diffusion is more effective, but it doesn't stop us. This here is a propeller of the size of a bacterium. And we can also build things which are much, much smaller than any swimming microorganism. And then we can have, for instance, here a width of 70 nanometers, which means it can be small enough to actually navigate real tissues. So we can get lots of them. We can actuate them in water. They're very small enough according to the measurement to penetrate gels. But it turns out it's more exciting than this. It's not enough to penetrate real tissues. And we still need to address the point of biocompatibility for real applications. And here is the first example we looked at, which is mucus. And mucus can be penetrated by a pathogen. One famous example is Helicobacter pylori. These two Australian medics proposed that the stomach ulcer is formed by this bacterium. People didn't believe them. In the end, they were right. And it sort of is able to penetrate the mucus. And this has the same length scale as our structures. And this is from not our publication, but it's from another publication. But the amazing thing is, if you look at one Helicobacter pylori, which we know that can go through mucus, if you look at one single one, it doesn't seem to be doing so great. It seems to be spinning, but it's actually not swimming. So it's small enough to make it through the network, but somehow it's still stuck. So it isn't quite so trivial. But we do know they're able to go through mucus because, after all, otherwise they couldn't cause the stomach ulcer. So what do they do? And here are these, oops, sorry, I was hoping this would play. Now it plays. After some time, you can see this is zoomed out. They start to swim, right? So what have they done? Well, they are actually more than just a small drill. They are a machine that can change the mucus environment. So what the Helicobacter pylori does, it excretes enzymes into environment. The enzyme takes urea, converts it to ammonia. Ammonia increases the pH, and under higher pH, the mucus becomes liquid. So after it liquidizes, it can swim, right? Before it cannot. And this is exactly what we did. Here are our artificial structures. Without enzymes, they drill, they rotate like the real enzymes, but also they don't do it. And if we then add enzymes to these artificial drills, you can see they can start to propagate. So we can take this inspiration, reduce the force that is required, and we still need some biology to make things happen for real penetration of tissues. And then another area we've now been working on for some time, and we're still working on, we're very excited by this possibility, is to try and attempt gene delivery in a real organ, in this particular case, the eye, because it's very sensitive. And right now what is done, the needle is taken, you puncture through the eye, you go through the retina, you inflate the retina and detach it to then inject your material. Can one do something which is much more or less invasive than this? And same problem, the vitreous is a hydrogel-like structure with hyaluronic acid and collagen fibrils, so it will have a network. We can build small structures, and we can try to inject and then move these structures towards the retina. The size should be correct, as we've established. Do we also encounter some kind of challenge like we did in the mucus? And the answer is, again, yes, nothing simple. These molecules that form the mucus, the mucin, are actually very complicated. They consist of sugar and amino acids. They have different charges. They are hydrophobic, they're hydrophilic, they have positive regions, they have negative regions. So things really get stuck. They either get stuck because they're too big. This is from another publication where people have looked at particles with different coatings. And things always somehow don't penetrate very well. And indeed, if we take our structure, and here is one, and we put it very deep into the vitreous, again, it has the size, it should move, but we have a problem again, it gets stuck. So in this particular case, the answer seems to be that we're dealing with this rather difficult environment where adhesion is a major problem. And so Ziggy Wu took inspiration from nature. In this particular case, they're ants, and there are pitcher plants that have a very, very slippery coating, which cause them to fall in, and so the plant can eat them. And this coating is something which is very similar to medically approved fluorocarbon compounds. And it's very, very slippery. You know, fluorine type materials from your Teflon frying pan. And so here now the task was to take these drills, to coat them with a perfluorocarbon silane, and then even to put on a perfluorocarbon liquid so they don't aggregate and move. And remember, the one without the coating got stuck, And if we have the coating, it is now able to travel through the vitreous. And so here is an OCT image where we see tens of thousands of them that has traveled about 1 centimeter with the coating through the vitreous and reached the retina. This is the image on the retina. And we see that they're very directional in their motion and they don't get stuck. And so this is a nice delivery agent. And we have, again, needed to overcome this problem of the adhesion and the material. The size means we can use weak fields. And now, as a very last comment about biocompatibility, because we're using inorganic materials and we're using magnetic materials, and that sounds like it's not something you would want in your body. But there's good news on this front. And the good news is really a remarkable material that we've started to work with. So you're familiar with nickel, cobalt, iron oxide. Bottom line, to cut a long story short, if it has good magnetic properties, it's toxic. If it's compatible, it's usually a weak magnetic properties. We want strong magnetic properties so we can operate with weak fields and transmit through tissues. And really the answer is something which is strange if you think about it. Taking iron and adding a non-magnetic material like platinum actually makes for a supermagnet. And in this particular case, it needs to be in a very particular form, which is called the L10 form. This is the sort of stacked form here. And this iron platinum in the L10 form has no corrosion properties. You can manufacture it. You can see that it is very biocompatible, has low toxicity. And the amazing thing is its magnetic moment is on par, almost as good as the strongest magnets, which are these fun magnets you can play with, neodymium iron boron, which would be totally unsuitable in the body because it's toxic and it's corrosive. So this is a super material, and Vincent has, and I'll finish with this, managed to incorporate it in the fabrication. We can have an annealing step so that it has the right crystal form, and a tiny little bit of it is enough to impart the magnetic material. We can have coatings on it, in this particular case, polyelethylenamine coatings, put plasmid DNA on it. Again, here to prove that the magnetic properties are really phenomenal. They're very, very strong. And this makes for non-cytotoxic, ferromagnetic, strong magnetic moment materials which can be used for a variety of applications. I think it should also be interesting for micro applications and micro robotic applications. And here is the proof. It works. It goes into a cell. We have expressed a green fluorescent protein. The cells have been tested under these typical tests to make sure that they are not stressed and everything is good. And with this, I'll conclude. I think we have here now some interesting materials. The message is that being small helps in the penetration where there is still difficult to exert the right forces, but one also needs to take account of the chemistry and physics in the particular context of the tissue. And with this, thanks to you for the attention, and thanks, of course, to my group for listening, and I'll be very pleased to answer any questions. Thank you.
Wonderful. Pierre, a fascinating presentation. Thank you very much. As always, we've got questions from the audience and there are questions from me. And I guess there are two sets of questions because they're two rather different topics. At the macro scale, there's phantoms, and at the smaller scale, there is, this whole world of nanorobotics. The first question is from Ihan, and I guess it relates to the first part of your presentation. And it reads, and I should move it here so it looks like I'm looking at you in this digital world. Thank you for the presentation. I was wondering is your phantom able to capture the viscoelastic characteristics of mammal tissue, especially time-dependent stress relaxation properties? Which is sort of a question I also had. We have done some work ourselves in trying to mimic tool tissue interactions with realistic phantoms. And we always end up having this compromise, things that are either accurate from a material properties point of view, but then they lack on the geometrical accuracy. And then vice versa, you've got things that are geometrically perfect, like some of the presentation slides that you showed. But then, of course, the difficulties in the mechanical response or the fluid response. So have you had any luck in sort of marrying the two?
Yeah, so I think, I mean, that's indeed the challenge, because often you need these very high water content, hydrogel-based materials, which often don't have the rigidity. So then if you look at them alone, that can be a challenge, although I would like to point out there has been some fairly recent progress to make a strong, tough, even hydrogel materials. So there has been really a remarkable progress in the field. So it's not the case that one can get the mechanics, can't get it right. But then the other thing which I think is an advantage in this molding method is that we are not restricted to pure materials, like you might be in a 3D printing cartridge or something like this. We can have, it can be a little bit like cooking, right? You can find your formulation. So we can include fibers, we can include cross-linking networks at different length scales, and we can still ensure we have, for instance, the right water content. If we don't have the right imaging contrast, we can add artificial imaging contrast to get, for instance, the right X-ray contrast or other things. There's nothing that stops us from throwing in a small concentration of nanoparticles or so to get the right imaging while also allowing the right mechanics.
So we had sort of, we spent a good few years in developing phantoms which are realistic in brain, minimally invasive brain surgery. And I think the one problem we had, and I was not working only in first person, or a very close colleague of mine, who's Daniele Dini, who's a tribologist, really trying to put our thinking caps on about how to make them realistic. The problem is you go to the literature about biological counterparts, and the error bars, right? The standard deviation on the elastic modulus of gray matter in the brain has got basically, it spans an entire order of magnitude. And so it's difficult to even know, because surgery is many times is so subjective, what is the sort of goalpost you should aiming for.
Yes,
So did
and
you
I
do
think
any work with mechanical engineers to even tease out the sort of properties that you should even be trying to mimic with your phantoms?
yes, I think this is correct. And I think one additional thing that that you will undoubtedly have also considered is that it is very much dependent on the length scale, isn't it? So, I mean,
Correct.
depending on how big your tool is, you might encounter a totally different rheology as well. And one would also need to consider that for real systems. And yes, and so we try to actually do both standard rheology measurements, and we also do mechanical testing. We pull on things, we press on things to measure them. And we also find that there is a total lack of good literature. So we're very pleased that in some cases we will have the opportunity, for instance, to work with human tissue from organ banks and things, which hopefully will provide some more accurate numbers. But when we have these questions and we ask the medicals people and say, well, what is the Young's modulus of whatever, the retina or something, there are blank stares and there's no literature. So one has to measure it. Yeah. And I think one has to do it depending on the right size. And then hopefully there's hope to capture and I think you will not have a model that will capture everything, because then you would have the organ. But if you know what your procedure is important and what the surgeon looks for, my hope is that the most important ones can be captured and copied. And in some cases, I think we've managed to do that.
And have you had any experience in Fraunhofer on the next generation of 3D printing technology that could actually help? Because now you're using a classical manufacturing approach to do your hocus pocus mixing of all of the ingredients to try to mimic at least aspects of the organ. But there is this sort of nascent technological area where you're trying to actually print predominantly in scaffolds, but actually also on the organ side. Is it something you do there as well, or or
no,
not?
we haven't done that. I think you're referring to things like, for instance, scaffolds in which you could grow
Correct.
actual
Yes.
cells and
Absolutely.
tissues.
Yes.
Yeah.
Right.
Yeah, that is, of course, that would be even more sophisticated, but it's quite a tall order to get everything right, because then you would need to also get the vasculature right. You need to get the right diffusion of things in and out, and you need to make sure it also withstands and is durable for a long enough times to be practical. And this is a little bit the luxury, which is maybe sidestepping this and doing it on a coarser level by having, if you like, concoctions or mixtures that mimic the real tissue. But there you also have the luxury of preserving them, making sure they are a little more robust and that they can be done in a more repeated fashion, and that they're not so time consuming. Because if you actually have to 3D print the whole thing, that is very, very time consuming. So you could never produce 20 of these, which is needed. For instance, we've worked with endoscope companies, and they want lots of them because they want to demo them or test the instruments.
Correct, several times. Well, one thing is for sure, for us, it took 4 years to even do the mechanical measurement to try to abstract the properties that we were then trying to replicate with a brain mimicking material, just because I think after, I don't know, scouting the literature for over a year to try to figure out what it is we were trying to aim for, we decided we need to measure it ourselves, because it's just
and then the recipes you find, they say agar, but I mean, it depends very critically whether it's been in the fridge, it hasn't been in the fridge, and for how long.
Process, I mean,
you can get 10 answers from the same recipe.
I agree. Okay, so I don't want to monopolize the conversation. There are quite a few questions, and I guess we're sort of shifting already to your amazing work on nanorobotics. And the first one is from Ricardo, and he says, "Thank you for your presentation, amazing work. Do you think that you will be able to use such nanorobots to deploy drugs directly into a tumor, for example, a brain tumor in the future? And how much is the dragging force